Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. I would like to present about our research conducted by me, Mahdiyyah Husna, under the supervisor Dr. Santi Martini by the title Determinan of Mortality in COVID-19 Patient, a Scoping Review. Introduction. The high mortality rate for COVID-19 is caused by several risk factors. In general, the entire population is vulnerable to COVID-19, but research shows that the elderly and people with comorbid are more susceptible to COVID-19. In addition, COVID-19 patients with severe manifestation show laboratory abnormalities. Various factors that may be the cause of death in COVID-19 patients, which cause the scope of research, is still relatively wide. Therefore, the purpose of this study is limited to identify the determinant associated with mortality of COVID-19 patients, including individual characteristics, comorbidities, and laboratory parameters associated with COVID-19 mortality. Our research used a literature review method with the scoping review approach, and the articles are obtained through the database of international journal providers such as ScienceDirect, Google Scholar, PubMed, and JAMA Network until 1st June. And here is the keyword we used. We also use the Prisma for scoping review diagram to describe our process. For the independent variable of this research were age, gender, hypertension, diabetes, C-reactive protein or CRP, and lymphocyte count, while the dependent variable was the death of COVID-19 patient. Here is the Prisma for scoping review flow diagram. From the search process using keyword in database, we got more than 5,000 articles. Then we have screening and follow this process until we got 27 articles that meet our criteria included into our research. Here is the mapping of our scoping review research result. And this mapping refers to PCC, or population, concept, and context. The blue colors show the population, and the red color show the concept, and the green color show the context. The population here means the participants who are involved to the found article, and for the concept, it means that the topic of the COVID-19 mortality, and meanwhile for the context, it's like a subtopic from the concept before, and we divide it into as shown in this image. And also you can see about the number there. The number refers to how many the article we found covering about each topic. Next is discussion. First, individual characteristics associated with mortality of COVID-19 patient. Elderly is a risk factor that plays an important role in the death of COVID-19 patient. Age shows the highest and strongest relationship with COVID-19 outcomes, where as age increases, the risk of death also increases. In fact, it is one of the determinants of mortality in COVID-19 patients. COVID-19 outcomes were comparable between men and women. However, in another research, men had a higher incidence of death than women. Therefore, apart from the elderly, the predictor of in-hospital mortality was male. Next is the comorbidities associated with mortality of COVID-19 patient. Patients with hypertension have a higher risk of death. It showed that patients with comorbidities, including hypertension, were the determinants of death in COVID-19 patients. However, this is different from another studies which state that hypertension is not associated with death in COVID-19 patients. The prevalence of hypertension in people infected with COVID-19 is almost the same as in the general population, even slightly lower. Also, diabetes is a risk factor that determines the death of COVID-19. This is in contrast to other research which states that diabetes is not associated with death in COVID-19 patients. The last is laboratory parameters associated with mortality of COVID-19 patients. Patients who died from COVID-19 had a higher hyperinflammatory marker, that was CRP. CRP can be used to predict disease severity and severe complication in COVID-19 patients. In line with other studies, elevated CRP was a significant predictor of COVID-19 mortality. Mortality rates were relatively higher among patients with low lymphocyte counts. A decrease in the number of lymphocytes is associated with a greater risk of disease severity. Lymphocytopenia is one of the factors that predict hospital mortality due to COVID-19. So it can be concluded that individual characteristics, comorbidities, and laboratory parameters were related to the mortality of COVID-19 patients. For individual characteristics, male was strongly associated with an increased risk of death, while elderly was one of the determinants of mortality in COVID-19 patients. Comorbidities consisting of hypertension and diabetes, both of them were risk factors that determine COVID-19 mortality. For laboratory parameters, the increase in CRP can be used as a predictor of COVID-19 mortality. Likewise, a decrease in the number of lymphocytes can be a predictor of in-hospital mortality for COVID-19 patients. Here is the reference we use. I think that's all. Thank you for listening.